So thank you. Hello, everyone. My name is Norway. You can call me William. So I'm from Lean Enterprise China. Right now, I'm responsible for Lean Healthcare in China. So in the past several years, we help Chinese hospitals to implement Lean to help to improve the patient satisfaction and also the medical quality and the operational efficiency. So based on the experience, we published a book named Lean Healthcare: How to Implement Lean in Chinese Hospitals. I am the co-author of the book. So today, I would like to share a case with you all around the world. Less is more. Reducing waste for ICU nurses to return times to patients. Firstly, I would like to introduce a little bit background of the hospital. Actually, the hospital is located in Dongguan City, Guangdong Province in the south part of China. Its official name is Dongguan Ace Hospital, but people like to call it Giraffe Hospital because a giant giraffe statue was set in front of the main hospital building, as the picture you can see. It's a general hospital, but more focused on children. It has over 1,400 beds and 1.2 million outpatients per year. It's a kind of common middle-sized hospital in China. So let's go to the problem in the ICU. By the year 2018, the problem in ICU is very critical. First of all, the patients and families are complaining. The satisfaction was decreasing. They were complaining about the service, the quality, and also the cost. The cost is high, service is bad, something like that. On the other hand, the nurses also were struggling. In that year, 2018, 7 nurses quitted, and the quit rate was 16%. Just imagine, if you are the manager of the ICU department, how can you improve or provide better service and quality in such a high quit rate? When we talk about the flow, the pull system in Lean, before that, we need to think about the stability. In this case, we need to talk about and think about the stability of the people. So why people leave? Why do nurses don't want to work in this ICU? They just want to leave. As discussed in the organizational behavior, when we talk about the people, the reason they leave the work, we need to think about the stress in the workplace, actually. So stress in the workplace, sometimes it's good. Sometimes it's good because you could, in your experience, sometimes you can feel if there's some stress, you can feel it's challenging, and it gives you some opportunity to growth, to learn, to achieve higher goal. But sometimes the stress gives you just the feeling of exhausted, feeling of tired. So actually, there are two kinds of stress as the stressors. The first one is the hindrance stressors. That means the stressful demands that are perceived as constraining personal accomplishment or goal attainment. So this kind of stressors, it's only make you feel tired, feel exhausted. There's nothing about learning, nothing about growth. But another is challenging stressors. That is about the stressful demands that are perceived as opportunities for learning, growth, and achievement. So in this case, in this ICU for the nurses, we can think about it, and we can see the workload the nurses mentioned is mainly about the stress in this ICU, and also it's mainly about the hindrance stressors. Could we have more nurses to work in the ICU to reduce the workload? The answer absolutely is no. So we need to think about how to remove this kind of hindrance stressors in the workplace to reduce the workload of the nurse so that they can provide better care to the patients. Happy employee, happy customer. But in lean thinking, I think waste the waste mind to reduce waste is a very good approach to remove the hindrance stressors. So if we can reduce some waste, it's non-value added to the work and also is kind of hindrance stressors to our nurses. We need to reduce it. We need to then we can create a better work atmosphere in the workplace. So the nursing head, Miss Song, led the team go to the Gamba to understand the current state better. They found that there are 30 beds in the ICU, and by that time, 11 people in day shift. So that means one team leader, 9 duty nurses, and 1 auxiliary nurse. The team worked with 4 of 9 duty nurses and 1 auxiliary nurse. That means in total 5 nurses. They found that each nurse worked average 126 minutes. It's around 24,000 steps, 15 kilometers. That means 30% of the working time of each nurse for those 5 nurses have been watched. It's just walking. And also the team found that 25% of working time, the 5 nurses, they are searching for equipment and materials. So based on this Gemba work, we can see that one side, the patient will complain the service, the quality, and also the nurses were complaining about the workload, something like that. So everyone wants to quit, or just want to leave the ICU. But on the other side, we can see more than half of the working time is just walking, searching, is totally non-value added to the patient. And that leads to another problem. It will make the nurses feel no value in their work. So, but so much, so high percentage of the non-value added work, but what are they doing exactly? So when the team went to the Gamba, they also recorded the work content and the time spent on each content of the 5 nurses. I'm not going to the details, but if the left chart you can see it's a summary of the working time of the duty nurses. And the right chart is it's a summary of working time of auxiliary nurse. So we have right now we got the time, we got all the records of the nurses. So we move to the another stage, analysis. So for duty nurses, why do they work so much? The team chose 11 items, consumed 80% of the working time. Also, I'm not going to the details, but I would like to share 2 items with you. The last second one, you can see the prepare spare beds. That means the duty nurses need to. So when the bed is empty, the duty nurse need to prepare this bed and get it ready for the next patient. But when they do the preparation, they need to grab all the items or the supplies from different locations. But what's the reason for that? The nurse need to walk back and forth, make trips. Why do they need to walk so much? Because all the supplies and materials have not been organized well. So that's the reason. For the last one, order meal. So why the nurses need to walk back and forth? Because as ruled it's a rule. All the nurses need to order meal for lunch, for dinner. They need to go back to the nurse station to register wherever she is. So, but right now is the 20th of the 21st century. We do not we do not need to write down the the the, the order on a paper to order meal. We just need to use our cell phone to scan a barcode, then get the order done. It's easy. So when we ask five whys to understand why duty nurses work so much, and then we are also ask five whys to about the auxiliary nurse. Why do they work so much? The team chose 7 items, consume 80% of the working time, and based on the 80%, 80-20 principle, the team summarized the following actually 4 main root causes. The first one, the ICU materials was stored in a central location that required nurses to walk back and forth to pick up items. That's the main reason. The second one, the storage room inventory was poorly categorized, plus the uncertainty of goods availability caused nurses many wasting trips and lots of searching time. The third one actually is about some functional rules and responsibilities was not clearly defined. It's mainly about the task of IV distribution and the injection traditionally was carried out by auxiliary and duty nurses, but rules and responsibility were not clearly defined that occasionally caused customer complaints. So for the last one, the fourth one, some daily routine work consumed hours of nurse time every day. For example, the meal ordering, as what I described minutes ago. So next stage, we move to the action. The team, firstly, they came up with a mobile storage cart design that was equipped with frequent use materials to save time and energy for nurses walk back and forth. They also set up procedures to define what, when, and who to replace the materials being consumed every day to ensure goods availability. A similar application was applied for medicine cart as well, and the team further invited nurses as users to jointly design different carts for example, the IV injection cart, the patient bathing cart, and general nursing purposes, with supplies for more efficient devices. That's the first action. The second action, the team renailed the ICU storage room with the ABC categories methodology. The team optimized the ICU storage room layout and align materials in the ABC categories based on the usage frequency. They set up procedures for picking up quantities and held quarterly review for revisions. The other improvements include removing storage closed doors to make inventories transparent to all users, and in return, making every person responsible for reporting items below safety inventory level. This practice helped build ICU personal ownership and the responsibility in keeping necessary supply to all patients. So then the team goes to the third and fourth actions. The third one is about the roles and responsibilities. So the team actually discussed the issue and agreed to assign the therapeutic group and responsible for preparing agonists, IV and distributing it to patient bedside. And the duty nurse group then took care of the injection and replacing IV. With the redefined roles and responsibility, these two groups calibrate and commit each other to provide seamless care to patients. The fourth one actually is about IT support. So team requested IT to upgrade the meal ordering system to save time and alert for daily routine work. Because the meal ordering system is a very easy system. It's not complex at all. So it's not expensive, it's cheap. But previously, there's nobody care about it. Nobody asked for it. So the IT department never provided it. So right now, the team in ICU, they know the problem and they ask for it. The IT department just set it up very quickly. Then the ICU team reviewed the project and they're very proud of the result. First of all, the walking distance reduced from the 20%, 24,000 steps a day to less than 7,000 steps. That is from 126 minutes to 36 minutes, which means the team saved 90 minutes for each nurse per shift. So this time saving can reduce the workload of nurses totally. And also, they can increase frequency of ICU patient bed service. And this therapy care were made possible for converting waste to value-added work by nurses. The nurse head, Miss Song, was always thinking about how to provide more care, better care to the patient from the nursing perspective. But there's no time. The human resource was limited. So she can do nothing with it. But right now, 90 minutes was saved for each nurse. She can arrange the work much better. And also, the ICU patient hospital days were reduced from average 7 to 1 minutes to 5 to 8 minutes, 7 to 1 days to 5 to 8 days. So that also means the cost of patients reduced a lot because if you spend 1 day in the ICU, maybe it's 10,000 RMB per day. So the patient satisfaction rate reached 100%. Most of the important, the nurses right now, the workload has been reduced, and also they can provide their time, the working time, much more on patient, so they can feel valuable of their own work. No nurse quitted in 2019. That's most important. So the fourth outcome is the optimized storage layout, and they saved the storage space that was resulted from a 40% reduction of the ICU inventory. And also, the team, by arranged all the equipment to very much better, they converted the saved space from storage room to a private room. So this private room, you can see on the right, in the right picture. The private room, they are not set as a kind of VIP just for special people. No, they set up this private room for showing love and care. They provided this private room for those patients close to the end of their lives to enjoy a quality time with their families. So that also increases the patient and families' satisfaction. Especially for the families, they feel warm, they feel respect from the hospital. So in addition to the ICU project, the hospital actually accomplished other projects that include the surgical room first operation on time rate increased from 65% to 95% in 4 months. Surgical operation bed turnover time reduced 40% to 50 minutes. Operation nurse overtime reduced 50%. And also the operation room utilization rate increased 25%. On top of this improvement, as I mentioned, this hospital, it is a general hospital, but more focused on children. So the hospital management team has done more work to distract children from fear. For example, they relocate the pediatric department from the second floor to the main floor, the first floor, to reduce the walking distance to comfort the parents of the babies of the young kids. And also, the new facilities provides an open and pleasant surrounding with fresh air, sunlight, and game facilities that help distract children from fear. More importantly, the outside, the outside space reduce waiting room crowding by 30%. That minimizes the risk of spreading contagious disease. All the above changes were made through lean healthcare improvement that intends to satisfy patient outcomes and healthcare givers, to provide a quality health service, and to make the hospital operational system sustainable. So the last part, I would like to share some current key learnings with you. So the first key learning is when we talk about lean, actually, we are talking about the behavior changing. So people would like to try after he or she experienced the benefit of lean. We need to think about the model of witness, feel, then change, instead of analyze, think, then change. According to the book of The Heart of Change. It's written by Professor John Cotter from Harvard Business School. So it is about this book is about change management. According to the study, many people think we make decisions to change our behavior just based on the analysis. But the study shows that most of the time, most of the people change their behavior based on their feelings. If he or she cannot witness the witness, the case, experience the benefit, he or she cannot feel it, then usually he or she will not change the behavior. So we need to think about it. That's the first. The second, key learning. The ICU head nurse Miss Song got her aha moment by not adding more people, but reducing waste to solve problem, to study and started to apply lean in other processes. So first of all, Ms. Song, she just think, okay, we need to, right now the workload in the ICU is too high. So many people quitted. So we need to add people. We need to get more nurses to work in the ICU so that the workload can be balanced, to everyone. But so many, 16% of the nurses quitted. I heard a story about a nurse in the ICU. So when the director of the nursing department, she rearranged rearranged the nurse from the other department to the ICU department. The nurse just went to the director of the nursing department's office and cried, "Boss, if you really ask me to move to ICU department, I will quit." So what's that? Even though this nurse has not been in the ICU, she just got the information she was going to the ICU. Then she wants to leave. She wanted to quit. So by that time, all of the team in the hospital, they just think, okay, we need to solve this problem to reduce the workload. We need to get more people to do it. But when we talk about less is more, to reduce waste in the work, they solved the problem very well, and it surprised everyone. That's second learning. The third one is the Giraffe hospital management team was encouraged by this pilot project. Pilot project is very important in an organization to help the team, the whole team to understand it. And they accomplished the other 19 Kaizen projects to satisfy patients and the health caregivers in 2019 and keep practicing Lean from 2019 to date. So less is more. Reducing waste for ICU nurses to return time to patients. The success was made possible because of participants' effort. We also owe an appreciation to the hospital management team for the engagement and support. I would like to thank Marcus for his coaching during the past years, and I would like to thank Denise and John Shook for the opportunity to share this case, this story, to all around the world. Thank you. Thank you all. Time for question.
Thanks, William. We've got a minute or so, I think. Questions? Was there anything else that you wanted to add? I do have one here for you, William, which was from Kim. Lots of excellence and greats here. William, what kind of instrument was used for illustrating the go to Gemba? Was it a spaghetti diagram?
Yeah, the diagram looks well, but actually it's drawn by hand.
Well, there you go. It's very inspiring is the feedback that's coming back from here. So that's wonderful. The best kind, says Janelle. So thanks, William. If there's nothing else, I think we're pretty much ready to go almost to the next session. So appreciate your time, everyone, and big claps all around.
Thank you.
Thanks, William. Thanks, everyone.
Thank you. Thank you.
Bye.